My name is Shane Diaz. I'm one of the diagnostic radiologists at X-ray and Imaging. X-ray and Imaging, we perform low-dose CT across multiple sites on some of the latest scanners available.
My name's John McCarthy. I'm the Operations Manager for X-ray and Imaging Morayfield. By applying a tin filter, we can essentially cut off all those low energy photons from escaping from the X-ray tube and save your patient a significant amount of dose.
The new range of CTs that are coming out now are far lower dose than anything we've seen before. It's much more comparable to an X-ray dose than any CT we've ever had before.
This is allowing us to X-ray CT things like chests, kidney stones, extremities, spines, sinuses for roughly the equivalent of 1.5 to 2 times that of an X-ray series.
If somebody has had some trauma, it normally starts off that they have an X-ray. There's certain joints that are complicated to image. There's a lot of overlay of the bones. It's very often difficult to see subtle fractures that are present.
Case in point, we've got this, which is a very innocuous looking ankle, but once we bring it onto the CT scanner, we can see that it's really quite dramatic posterior fracture through the tibia.
You can pick up all sorts of other things that you weren't necessarily looking for when you went through the area. So even unrelated pathologies, we've picked up a number of cancers that were completely unknown to the patients. So we've got another situation here where a patient has a known cancer of the ovaries, and they're doing a chest X-ray to have a look and see if there's any spread to the lungs. And on the chest X-ray, when you have a look at it, it looks pretty normal. There are no obvious masses in the lungs or anything like that. That would be called normal. A CT scan of the same patient shows not that there is a mass within the lung fields, but there is a mass that's actually attached to the heart. And there's no ways you would see that on a chest X-ray at all. So it just shows the incidental findings that can be picked up on a CT scan as opposed to plain film imaging.
With a traditional X-ray, you're only going to see a lesion or a mass or consolidation once it approaches a reasonable size, maybe 1 to 2 centimetres. And in the case of an aggressive tumour or an aggressive disease, this can be too late and really affect your patient's mortality outcomes.
So for no cost to the patient, we can now provide many, many times more information.